Now, Love FM's Nana Aljima also reports that general ward and outpatients department services as the Suntreso and other hospitals have resumed effectively. He joins us live with more. Nana, tell us about the difference in the number of patients reporting to the facilities you visited. Nanayao, if you can hear me.
Hospital and also the Dementia Hospital.
Go ahead, Nanayao.
Officers there.
Right, Nanayao Jima is our man in the Ashanti region. And Nanayao, if you can hear me, let us know what's the difference when it comes to the number of patients reporting to the facilities you visited.
For that, visit the hospital daily, but they couldn't give me the exact. Hello, Daniel. Can you hear me?
Yes, you're live.
Daniel.
Daniel, you're live. So live on JoyNews today. We apologize for the poor connection there between Nana Aljima and ourselves. He's currently stationed in the Ashanti region. Now, a bit of background to this story. Last week, a letter was sent to the Ghana Registered Nurses and Midwives Association in the here in Accra. And this letter was an injunction, which was to stop them from going on strike. They did not receive the letter, and so they went on strike anyway on Monday. So what we are trying to find out from Nanayao, and he's just rejoined us on the telephone, is whether or not there is a difference in the numbers of patients that are visiting the hospital. Nanayao, can you give us a fair idea?
In the Ashanti region, I've been to the Kumasi Teaching Hospital, the Suntreso Hospital, and also the Dementia Hospital so far. And in all these facilities, I can say that there's been an increase in the number of people who visit the hospital regularly. The health professionals there couldn't give me the exact change in terms of nominal figures, but from what I've heard so far, there's been a rise in the number, especially at the Suntreso Hospital, because the Suntreso Hospital had to shut down its maternity and also ward throughout the period that the nurses were on strike. So when they resumed, all those who were scheduled to visit the hospital on Tuesday, Wednesday, and also Monday have all today come to the hospital to receive the attention that they needed. So if you go to the maternity and also some other services that were put on hold, those areas demarcated for these people have seen a surge in numbers, including the special units. For instance, people with hypertension, diabetes, and other health conditions who on Tuesday reported. So for the Kumasi Teaching Hospital, what they've done is that some of them who were scheduled to come, say, on Monday or Tuesday, some of them had to go back and return on the day because those are the days that they have designated to give such services. Others have been told to come later in the afternoon after 1 p.m. where doctors who take care of such situations will come.
Right.
So the hospital officials are trying to deal with these situations which have taken them by surprise.
Okay, Nanayao, you have spoken to some of these nurses, I assume, who have returned to work. What's their demeanor like?
Okay, a number of them are okay because according to them, they've left everything to lead front. So they're strike and take the necessary action. And, seeing what's happening at the hospitals today, they believe that their services are needed. So today they've returned, and at the Suntreso Hospital, the nurse in charge will have to double up to deal with the numbers that they are seeing today because, as I said earlier, the numbers have surged.
Thank you very much, Nana Aljima. Let's go to the Volta region. Ivy Setoji is standing by. I still remember those images of empty hallways and abandoned hospital facilities that you sent in earlier this week. Ivy, how much has the situation changed today?
practically, Daniel, has changed nurses. Should I say 70 or 80% of nurses are there in the hospital working? But surprisingly, patients are not in. Most patients are not in. It seems a lot of people are not aware that the nurses have resumed work today. So you don't see a lot of the patients in this general hospitals or a public hospital. But for the nurses, most of them have resumed work and are working normally as if nothing has happened. Most of them wouldn't want to talk to the media. And those of them who offer to talk off camera today, but they are happy to get back to work and serve Monday.
Now, Ivy, for a setting like the Volta region where you are, when people are sick and they do not go to the hospital as we know it, what are the options available to them? Can they go to private clinics, for instance, or do they go to traditional healers? Where do they go?
Yes, of course. In the urban areas, in the region, for example, people also prefer to go to the private hospital where they think the services are better, so they think. So when it happens like that, those that have needs go to the private hospitals. A lot of them are around. But in the rural areas, the villages, for example, they have the herbal healers, the traditionalists who also take care of them.
Right.
So they also explore those options as well.
Ivy Sesoji, thank you so much for those updates.